Good evening, everyone, and welcome to this webinar, Supporting Carers, Your Rights, Wellbeing and Future. I hope that you can all hear me okay. I think we're having a bit of an issue with the chat, so my apologies if that's not working. But we'll proceed. We'll have some interesting discussions today in any case. So my name is Emma Koivunen. I'm a coordinator working at a charity called Gaddum within Carers Manchester coordination team, and I'll be chairing the webinar tonight. Our webinar is part of Carers Week. This is a national week to raise awareness about carers issues and to celebrate the contributions that carers make. There are many events taking place online and across Manchester during this week. However, caring doesn't just happen just during 1 week or during working hours. For many unpaid carers, it's a 24/7, 365 days a year role. And many carers are struggling with finances, with their own health and well-being, and with finding time for themselves. In Manchester, according to the latest census, there are over 37,000 unpaid carers. However, we know that there are many more. Unpaid carers can take several years to see themselves as a carer instead of just a family member, a friend, or a relative who supports a loved one. Identifying yourself as a carer can be beneficial as this can open doors to practical, emotional, and financial support. In Manchester, a lot of the support for unpaid carers is provided by Carers Manchester. This is a partnership between statutory organisations and local and national charities that provide support to unpaid carers in the city. The first point of contact for many carers is the Carers Manchester contact point, which provides support through phone and email. The contact point provides information and advice about carers' rights and support available, benefits advice, signposting, and referrals to other organisations and for carers assessment. Now, if I get the chat to work, we will put contact details for the contact point in the chat. But if it doesn't work, we'll also send you some information afterwards by email. Also, our Carers Manchester website and our newsletter are useful sources of information about carers' rights, events, and support available. This webinar tonight has been planned by unpaid carers, for unpaid carers, and for professionals working with carers. This is the first event organized by our Carers Lived Experience panel, and the Carers Lived Experience panel is an opportunity for unpaid carers to share power with professionals and use their expertise to make positive changes in the community. For the webinar today, the panel members wanted to bring together policy discussion and practical advice, and we have three interesting discussions with some great speakers. So the first discussion is on the topic of caring about equality. We know that unpaid carers face many inequalities, including a greater risk of poverty, social isolation, poor mental and physical health. At the same time, Manchester is one of the most diverse cities in the UK. Over half of Manchester residents are from ethnic minority groups. Nearly 1 in 4 residents have a disability or a long-term health condition, and the city is home to one of UK's largest LGBTQ+ communities. With carers coming from all different communities with different interests and needs, how can services support carers and work towards equality for carers? So for this first discussion, we'll hear from 2 people involved in planning and delivering services from carers. We have Abid Mumtaz, who is from Manchester City Council, and we have Ben Whalley from mental health and carers charity Gaddum. Then after that, we'll have the second discussion is about benefits and funding support. For that, we'll start the discussion with a carer sharing their experiences of accessing benefits and funding support. And then we'll move on to Michael Dietrich, who is the welfare advice team leader at Carers Manchester Contact Point. And he will talk about what support is available for carers. Then we'll take a brief break from discussions for a short quiz about carers in Manchester. This will be done through a poll, and as long as the tech works, it should show automatically on your screens when we get to that point. And then our final discussion of the evening is about mental health and well-being of carers. Again, we'll start this discussion with a carer sharing their experiences about how being a carer has impacted on their own mental health and well-being. And then we'll move on to Neil Grace, who is the lead for service user and carer engagement at Greater Manchester Mental Health Trust. And he will talk about support available for carers. But before we move on to these discussions, I have a little bit of housekeeping to go through. So after each of the discussion, there is time for questions. You can post questions for the panelists through the Q&A. So hopefully, again, assuming the tech works, you should find the Q&A option somewhere on your screen, usually either at the bottom or the top of your screen. You can add comments at any point. If your question is for a specific person, it's helpful if you mention that in your question. We have Eve from our Carers Manchester team moderating the Q&A, and she'll select questions from the questions to the panelists. And we've also received some questions already, so thank you for those. We'll do our best to respond to the questions during the webinar, but might not have time to answer everything, and we'll send some resources by email after the event as well. And then if it works, we also have the chat, but we'll see if I can get that working. We do have Ina from our lived experience panel who's going to help with the chat. Eve and Ina will hopefully introduce themselves in the chat. And if it works, please do join in the chat and introduce yourself as well. We'd love to hear if you're an unpaid carer, if you work with carers, or maybe you're both. For the chat, we have 2 ground rules. So if anyone shares any personal experiences, please treat those as confidential, and please treat different opinions with respect. And my last housekeeping note is that the webinar is being recorded and will be shared online afterwards, but any comments you post in the chat will not be shown in the recording. So we'll now move on to the first discussion, caring about equality for carers in Manchester. Our first speaker is Abid Mumtaz, who is the head of commissioning for older people, prevention and VCFSE in Manchester City Council. So welcome, Abid. I'll hand over to you now.
Thank you very much, Emma. And thank you everybody and for the invite to this really important topic. That's really close to my heart, but also from a work point of view perspective. So like Emma said, my name's Abid Mumtaz. I'm head of commissioning for older people and prevention for the City Council. I'm part of a team, and as part of our work and remit, we cover an awful lot of areas. And one of those areas, as you can imagine, is carers, hence why I'm here today. So some of the things that we do, I kind of want to touch on that before I touch on the other 2 parts around some of the challenges, and then also some of what we're hoping to are some of the solutions. So from our point of view and perspective, there's several remits from a commissioning point of view perspective. So the first one is obviously to commission services. And the way I liken this is, it's on several tiers and several levels. With the first one being the carers being at the heart of what we do. Second one is having the carers Manchester over and above and around the carer and offering that help and support. And then wider than that is the wider network that's available to access for the carer, but also for other key partners and stakeholders. As well as this very large piece of work, there's other key elements that have an impact on what we try and do and deliver. So as you can also imagine, internally we have the carers assessment statutory service. So that's a process that we do internally, and over and above that, there are other services that we try and commission as well as we possibly can, given the environment that we're in, and that's things around carer short breaks policies, for example, and procedures, as well as provision. So from a commissioning point of view, we try and follow a process and a pathway, something that we call a commissioning cycle, which is around being able to analyse, plan, secure and review. And I'll touch on some of these key parameters throughout this discussion. That's the first part as my introduction to myself, but then also to us as a team. I kind of now want to touch on some of what Emma was just saying, but also what this year's Carers Week is trying to shine a light on. That's around equality, and that equality is on several levels, and Emma's clearly touched on some of that, and it's around health disparity, health inequalities. reduced mental health, employment, as well as education. And what differentiates us in Manchester to other parts of the country, it's, I suppose, on several levels. It's again our demographics that we have, given and geography of where we are. So obviously we're based in the north. We have a very vibrant population, but that also has its downsides with regards to ethnicity. From a health point of view perspective, we know certain ethnic minorities have certain conditions, so therefore there has an impact. So therefore there's an increased prevalence of carers because of that reason and rationale for it. And then there's also a national perception of certain communities behaving in certain ways, but then how can we try and scratch below that surface to see what those needs are? Again, becomes really, really challenging. And it was also interesting when we listened to Emma when we talk about census data. I suppose that is one of the key things when I was in preparation for this is around that data, that information that we have. It isn't as strong as we'd like it to be. We always refer back to certain elements of this research has told us this, and the outcome is on certain levels. But what we would like to strive towards in Manchester is having more accurate data, and that accurate data on equalities, inequalities, to be able to prove a point, to say these are the needs of our Manchester population of unpaid carers. Because if you don't have that underlying benchmark, it's really difficult to be able to then give services to meet those needs. Because if you don't know what the needs are, it becomes really challenging. So that there's a couple of things that we are hoping to do that will help us get us over that line. So as a collective, we're part of the MLCO, which is an integrated way of working across statutory organisations, where we can try and pull resources and be able to raise a profile of what we're trying to do on a day-to-day basis, but then also as a collective. And I touched on some of my tangible elements of my role, but some of the intangible roles are exactly that. So whatever forum I go to, whether it's carers related or not, I will always bang the drum of actually what's happening. What are we doing more of? What can we do more? What can we do more of? What should we do more of with regards to unpaid carers? And ensuring that we're not forgot about with regards to, as from a system point of view and layer, rather than it just being a contract that we manage on a regular basis. It needs to be much, much wider than that. We have an awful lot of assets in Manchester, being able to pull on them from primary care, secondary care, as well as community services, to say, what are you finding with regards to your local population? How can we amalgamate all of that data and information that we're getting across the networks that we're hearing into one overarching strategy, which then puts me on to what we are hoping to achieve in the short term as an authority, is to do exactly that, of having a unpaid carer strategy that we can set over the next 2, 3, 4 years. This is what our aims and objectives are collectively. It can't be and won't be something that comes from myself or us as an organisation. It needs to come from grassroots. So what we're hoping to do and achieve is a co-produced strategy where we work with partners, where we work with stakeholders, and more importantly, we work with unpaid carers to say what's important to you as an individual, to your community. What can we do with regards to offering that help and support? And then beneath that is ensuring that there's an action plan, and working through that action plan that captures a lot of what's already in what we're hoping will already be in the strategy, to say the strategy has told us this, and the action plan therefore has to be chunked into this is what we will do. Because what we don't want to do is to write a co-produced carer strategy and then do nothing with it. It needs to be tangible. It needs to be one of those documents that is live, that people hold us to account for, and where we are able to work across partnerships, where we can hopefully have increased investment into this area, but then also that the increased awareness of work that we're doing around unpaid carers, but then also being able to plug those gaps around data, being able to highlight other things that are happening across our communities, to say from a signposting point of view, these are some of the things that we're hearing are working in other parts of the country, and what can we potentially piggyback on and do differently here and amend. Emma's appeared, so I'm guessing that's my time to be quiet.
Pretty much, yes. Thank you, Abid. If you can have another minute if you want to.
Yes, thank you. And just to round that up, so I've been in the authority for just under a year, and I've worked across several different demographics. Across majority of it is across the North and the Midlands. The key part that I'd like to stress that we have in Manchester are, well, a couple of bits. First and foremost, from an authority point of view perspective, I can wholeheartedly say that we care. We care about unpaid carers, and we care about making a difference. And that's just not from an authority, but also from the partners that we're going to hear about from and also much wider than that. Thank you, Emma.
Lovely. Thank you, Abid. Really interesting to hear from you and a great start to the discussion. So I'm not sure if the Q&A works, but if it does, if anyone has any questions to Abid, you can post them there. And after we've heard from the next speaker, we'll have some time for questions and answers then. So then next we'll hear from Ben Whalley, who is the Chief Executive Officer of Mental Health and Carers Charity Gaddum. So over to you, Ben. Thank you.
Thank you, Emma. Can people hear me okay? The yellow square, yeah. I mean, that's great. Okay, thank you. And again, to echo Abid, absolutely just incredibly grateful to be invited here this week. I think one of the important things I want to stress, and like any of these, this week is a really important time for raising awareness, but actually this is something that we're all dealing with day in, day out when we're carers. And so just to acknowledge that from the very beginning, but there's a lot of amazing activity going on this week to raise awareness, but it's about keeping that going and keeping that traction going as we move forward. So I don't want to repeat anything that my colleagues have said so far. Emma's done a really great summary of the demographics in Manchester and the census data and things like that. And Abid has also talked about Manchester City Council and how commissioning works. What I want to talk about is kind of focus in on equality and what we do at Gaddum, but then also where we can all go to try and make sure that unpaid carers are supported and ultimately can live equitable lives and that they aspire to. That's the really important one, because many of the services are often, I think that we experience when we need support, can often feel led by the service rather than by our own needs, really. And that's certainly not the case in the context of Manchester and carers services across Manchester. So in terms of Gaddum, as Emma said, we are a mental health and carers charity. We've been in existence since 1833, and ultimately our belief system hasn't really changed. We believe that people have the right to have equitable health, wealth and self, and that's for every individual and community that we work alongside. Underpinning all of that is that we often hear, particularly in around Manchester and other populations, almost being referred to as the high prevalence needs or acuity and kind of how serious certain needs are. But actually, we believe that all of us individuals and communities have the solutions already within them to get through the issues that they're facing. And so ultimately, we need to support stronger individuals and communities. On top of that, and links with our views around partnerships, Gaddum, we're an anchor institution for the voluntary community, faith and social enterprise sector. And ultimately what that means is that we don't think one organisation delivering everything is the solution. We think that it's about a partnership approach of many organisations that people will feel more safe and comfortable accessing, rather than being signposted to one that does carers or one that does mental health. That you have the people should be able to walk in the door of where they feel comfortable and get a service there that they will benefit from. We work across Greater Manchester and other areas of the north as well, and again furthering our charitable mission around improving the lives of people experiencing mental health and people who are unpaid carers. And I suppose moving into kind of the theme for this week, equality, it's such an important point for us to reflect on, really. What does it really mean? Because there's all sorts of different notions and different ways that people speak about it. Is it treating everyone the same, or is it treating everyone differently? As far as our approach at Gaddum, we believe in equity and in treating everyone individually completely differently based on what their unique needs are, really. In other words, how a person identifies and how a person aspires and where they want to be is where we will start to engage with people around. And it's funding from organisations, commissioning institutions like Manchester City Council, like the NHS, like other local authorities that make our charitable work possible. So that's a really important point to make. Data is an issue. And so one of the things that we also believe around equality is properly understanding what the needs are and working with individuals across Manchester based on those needs. Now, that's a really important point because people can often be referred to as hidden communities and things, which is a real frustration of ours. Actually, it's more about services being hard to access. So one of the fundamental things that we do is try and flip that on its head and make sure that we are properly engaging with people who are across Manchester and who may need that support. But there is data that we do know about. So we do know about the just shy of 40,000 carers that the census estimates, but actually, as Emma's pointed out, that is data is much higher than that. We know that people prefer to go into services that they feel comfortable walking into, as I've already said. So what we do is work in partnership with our amazing Manchester Carers network partners to make sure that their doors can remain open as well, really. We know that children as young as 3 and adult carers in their 90s are the kind of the age range of people who are providing unpaid care to someone who wouldn't be able to deal with their day-to-day life without that support. We know that women are more likely to be carers than men, and carers are more likely than other populations to experience mental health distress and also severe financial distress as well. So there is also a lot of data out there, but I fully agree with my colleague Abid in the City Council around making sure that we improve that and start to make more informed decisions on it. I just want to go into support for day-to-day things then. So we work with people through the contact point and on the ground, and we work with across Greater Manchester, 40% of the Greater Manchester population, to provide tailored support that is based on what an individual aspires to, rather than be led by the worker or by the organisation. That's a really crucial point. But then what we also do is influence. So using data, but also using our charitable approach. Our principles of co-production around lived experience and around sharing power are really, really important to us. No decision about me without me, and the autonomy of carers to have breaks, to not be carers, and to have career aspirations and other things is also something that we will support individuals with as well. And ultimately, we recognise through our workforce, through our own lived experience, that we are all, and we could be carers throughout our life as well. So at the heart of everything is co-production. Just before Emma cuts me off as well, is the third part of what we do at Gaddum, which is we campaign. So last year, many may remember the government was looking at benefit caps around carers allowance. There are ongoing looking at benefit cuts and return to employment. And myself and others at Gaddum were on national stages. We were being interviewed in the news. We were really kicking off, I suppose the way I'd say, around how inappropriate that was, and just highlighting simple things but really powerful things, like if we were to understand the cost of what carers are currently doing on a day-to-day basis nationally, it would cost the same as the entire NHS service. And so just recognising and respecting unpaid carers nationally is a really crucial one. So in summary, what we do around equality and around unpaid carers at Gaddum is we support, we influence, and we campaign. Thank you. I'm sorry I've gone over time slightly, but I'm more than happy to take any questions as well.
Lovely. Thank you, Ben. That was really interesting to hear as well. So we'll now move on to Q&A. So over to you, Eve.
Thanks, Emma, and thanks to Ben and Abid for your speeches. Throughout the discussion, anyone that's in the chat, please feel free to put things in the Q&A box if you have any questions. I'll start with a question that we've got for both Ben and Abid. The theme for Carers Week is caring about equality. What support is your organisation offering to tackle the disparities and disadvantages carers can often face to ensure a fairer society?
Shall I go first? So I don't know when that question came in. I don't want to repeat myself, but fundamentally for Gaddum, it's one of co-production. In other words, people being understood and being heard, and also being empowered to be able to have the aspirations and make the decisions that they want to be able to be where they want to be, really. So very, very much that is about engaging with an individual from a completely person-centered perspective. So our expert staff will engage with individuals where they are, whether that's in crisis, whether that's reaching out for support, or anything in between, to find out what people are wanting or needing, and then being able to kind of identify steps to get them there. Just on a strategic level, it's also about understanding through data that again Abid mentioned as well, the communities in Manchester that we might not be reaching. I hold my hand up. I'm a white British middle-class man. I am not the best person to speak for anyone other than me. I only have the lens that I look through, really. But it's in sharing power and decisions with others who are more representative of the communities of Manchester, that is going to actually see a more diverse and better represented service offer, really. So twofold, really. It's around understanding where the data is, but also providing service to individuals where they are, really.
Thank you, Ben. And from my point of view perspective, it's on 3 different levels. So I'm going to put them into 3 blocks of assumptions, knowledge, and evidence. So first and foremost, what we can't do, and what I refuse to, is make assumptions about certain communities, carers, unpaid carers, our population. It needs to be driven by knowledge, via the data, and being driven by an evidence-based approach. So what does the data tell us about our population? And also with regards to what does that needs assessment, and how does that inform our strategy with regards to what do we need to do next to be able to tackle the underlying issues? Because if we don't know what the key underlying issues are for what populations that we're trying to serve, it becomes really, really challenging. And I've been working with Gaddum really closely on a couple of elements, which is an awful lot of this. So they're working on a piece of work for us as a partnership around equality, ensuring that services meet the needs of our all of the population rather than some of our populations. And they can only do that via what Ben just articulated, co-production, but then also to scratch service and look at what's actually in the community rather than a blanket assumption being made of, I believe our population needs to put something into place. It needs to be a case of actually what's our population telling us, what's that data tell us, and then what's worked elsewhere as other parts of the system and country that we can potentially use to improve outcomes for our residents and population.
Thank you guys both so much for that. My next question could be for either one of you, whoever you think could answer this better. What can be done to ensure that the voluntary services are able to have affordable premises to base their activities in?
Can I just come in first a bit, but maybe you want to come in as well from a commissioner's perspective? One of the really important points that I think we need to make, and certainly I was another discussion earlier today on another in mental health as well, really, and this came up. The voluntary sector in Greater Manchester is under pressure like never before. In fact, between 2012 and 2022, £100 million each a year. The voluntary sector is £100 million poorer than it was in 2012, really. Now, that isn't because commissioning authorities have said that they don't think the VCFSE sector is any good, or it's actually down to austerity and real pressures with partners like Manchester City Council around funding organisations. So I just want to preface that we have a really strong relationship with Manchester City Council and with other commissioning authorities. And we work really closely to fully understand the costs of delivering services with them so that they can then commission in turn. But we're not naive as a voluntary sector to the pressures that the City Council are under.
Thank you, Ben. And then from my point of view perspective, it's on a couple of levels. So we know that the national drivers that haven't helped with regards to some of this. So around the increases in national insurance, which wasn't taken into consideration with the cost of voluntary sector, which then adds an extra burden on, and if you can't afford to pay your wages, and premises obviously come hand in hand. So there's that part of it. And then the other part I was thinking, actually, when I was listening to the question, was, is that wider part of around what we're hoping this week will go over? And it's that quality with regards and equity unpaid carers from a financial point of view and perspective. How much do we save the economy of being able to care for? Because, you know, and I always equate this to our home care provision. So if someone doesn't have a unpaid carer and they're entitled to a care package, a home care provider goes in, I'd say, you know, there's a cost attached to that per hour, but unpaid carers, they don't have that same cost attached, clearly. So it's us being able to shine a greater light on that, especially in Manchester with the political spotlight that we have in Manchester. Actually, look, you know, from a local point of view, and also a national one, this is what we saved the system. These are some of the tangible outcomes that we have across the system. So therefore, what can you do to help us with regards to some of those underlying costs? And please take us into consideration when you're doing things around national insurance contributions, for example. You know, but then also, what can anything be released nationally that can help the voluntary sector, but also unpaid carers, to be able to tackle some of this from a financial point of view and perspective? I think that's the best way that we can potentially do that. And being in Manchester, I'm hoping that becomes easy because of the political spotlight that's always on the city.
Great, thanks. And another question for Abid. Are there plans to reduce the current waiting time from point of referral to having a carer's assessment completed?
We're always looking at that. So we have a dashboard that we explore on a monthly basis, and that's reported into our governance structure, again, via a formal governance process. We've recently invested in additional staff to be able to achieve some of those targets. So to answer your question, yes, we are hoping it comes down. But if it doesn't come down enough as we would like it to, then that's another case of being able to go back to the authority to say, what can we actually do different? But yes, it's something that we are hoping will reduce, but then also over and above that, it's also something that we track on a monthly basis.
Thank you.
Great. Thank you, everybody. That's been a really great start to the webinar. So thank you, Ben and Abid, for your contribution this far. We'll now move on to the second discussion of this webinar about benefits and funding support for unpaid carers. We'll first hear from Lisa, who has been an unpaid carer for the last 20 years. She's also part of our lived experience panel and has been involved in planning this webinar. So over to you, Lisa. Thank you.
Great, thanks, Emma. I've been the main carer for my relative for over 20 years. It's a role I've had to do mainly on my own, with very little support, and it's been extremely difficult to manage. They've been on disability benefits for all that time, mainly personal independence payments and ESA, employment and support allowance. And now they've recently transitioned over to universal credit. I'm their appointee for benefits, which means I'm legally responsible for them. I fill all the forms in, arrange all the evidence, send it all off, etc. It's not an easy process to do, especially as a third party. And it's very time consuming and stressful. The forms are very complicated and lengthy, and the point scoring system that is used for benefits, especially with PIP, is confusing. When I've looked at some of the scores in past claims, none of it makes any sense, and points weren't awarded in the categories that I think they should have been. I think this is quite common and is something I've heard a lot of carers and service users complain about. It almost feels like a lottery or just plain luck as to whether people will actually be awarded the money that they're entitled to. The uncertainty of a disability benefit is also a worry for the carer, because if the cared for loses their entitlement to PIP or attendance allowance, then the carer also loses their entitlement to carer's allowance. This means that they may be forced back into looking for paid work and so cannot continue their caring role to the same degree. So the whole process of applying for disability benefits is extremely stressful for everyone concerned. Another issue that I experienced is that if you do claim carers allowance for a person that lives alone, they would lose their severe disability premium if they are receiving employment and support allowance. So in my experience, the whole system is very unfair. In the past, I've managed to stay in a part-time job alongside my caring role. This was for around 12 years. And this was really only because my employer was very understanding and flexible around my caring role. And so when appointments or crises arose, which they very often did, I knew that I could take time off and catch up with work at my convenience. Now, I know not all jobs are like that, and it can be very difficult for carers to manage both working and caring together. I found it very unfair that even though I was juggling both roles, that is caring and working, if I earned over a certain weekly amount, then I could not claim carers allowance. And even if you do claim carers allowance, that means you're looking after somebody for the same amount of hours as a full-time job, 35 hours a week. You would receive just £83.30 per week, which for 35 hours of caring works out about £2.50 an hour. And you also don't get paid any extra if you're caring for more than one person, which a lot of people are. This just indicates to me how little carers are valued by the government, the inequalities they face, and why lots of carers are on the poverty line. When my job ended last year, I had to apply for benefits myself, and it was a massive drop in income, which has been very difficult to deal with. I went to the benefits service at Carers Manchester, and Michael helped me work out which benefits I was entitled to and check that I was getting the right amount. He also advised me about other help, such as council tax benefit and carers allowance. The Carers Manchester contact point can also advise you about any other available council hardship grants, such as ones for white goods or utilities. I've also learned that water and utility companies can lower monthly payments for people that are struggling, and they can give grants such as the Warm Homes discount. There are also social tariffs for mobile phones and broadband providers if you receive certain benefits. Citizens Advice is another organisation that can also check your benefit entitlement. The benefits you receive as a carer are very hard to live on, and it's a struggle for many of us to pay our bills. One thing I wished I'd known earlier on in my caring role was about my entitlement to a carer's assessment. I think I was a carer for many years before someone actually told me about it. Through that assessment, I learned what support was available to me, and through that I qualified for the one-off yearly carer's payment, which helps me take a break or spend on something that helps me cope with the caring role, such as a massage or a pampering session or a haircut, something like that. They also put me in touch with other relevant services, such as Carers Manchester. One question I would like to ask Michael is about the proposed changes that the government is bringing in next year around disability benefits and the reforms to PIP and the work capacity assessments. A lot of carers and service users will be worried about this now. Is there any information you could give us at this time that could help ease some of the anxiety around this? Thank you.
Great. Thank you, Lisa, for sharing your experiences. It was really insightful and really quite frustrating to hear about the things you've had to deal with, but I'm glad to hear you've had some help from Contact Point, which then leads us nicely to our next speaker, who's Michael Dietrich from Gaddum, who's the Welfare and Advice Team Leader at Carers Manchester Contact Point. And if anyone has any questions on this topic, feel free to add those to the Q&A or the chat, and we'll pick them up from there. Thank you.
Yeah. Hello. Am I on this? Can you see me? Yeah. Okay. I just start talking. Hello. I'm Michael, and I'm the team leader of the Welfare and Benefits Advice Team at Carers Manchester. We are a team of two, myself and Amy, who couldn't be here today. And before I respond to your question, Lisa, I will quickly outline what we do in terms of benefits advice at Carers Manchester. So we do benefit entitlement checks for households, including all household members, so not only carers or the cared for, everyone, because the household as a full unit counts, to optimize their income from benefits, including advice on support with wider schemes related to benefits. And we provide form filling support, including PIP, so we can explain the scoring system or help just complete the form. We help making phone calls to the DWP, and we help challenge decisions made by the DWP, again, including personal independence payments, mandatory reconsideration, and appeal. In the last month, so May, we contacted 64 carers, including in face-to-face meetings. And following our support, we expect each of them gained on average £22 per week. But we also go out in the community and provide one-to-one support at events, or we do group workshops on benefits. And if there is anyone listening, any professionals who work with groups of carers, or anyone who is part of an informal group of carers, get in touch if you would like to get a workshop on benefits. Now to your question, Lisa. There is not that much I can say to ease your or anyone's anxiety around the proposed changes, and I'm pessimistic about them myself, but I still collected a few things. Firstly, nothing is going to change before April 26, and the 4-point rule for PIP will be introduced from November 26 and will apply only to new claims and to award reviews. Secondly, I'm a bit optimistic because there's quite a large opposition to the suggested cuts, and there's opposition inside the parliament as well. So 27 Labour MPs say they will definitely vote against the cuts. 170 Labour MPs are unhappy with the cuts and could say no. 100 MPs of all parties signed a letter to Starmer urging him to delay the changes and rethink the proposals. And the Work and Pensions Committee, which is kind of made up of members of parliament, has also called to reconsider and delay the proposals. According to rumors in the news and on political websites, so the Lib Dems seem to be against the cuts, the SNP and the Green Party as well, and it now also seems that the Conservative Party will vote against. So if that is true, the opposition inside Parliament, if it is so big, then that means the proposal will not become law. Yeah, nobody knows what's going to happen. Another reason to be slightly optimistic is that even if it does happen, the government is discussing some kind of compromises. So one compromise offered is to allow PIP claimants who score who score a total of 12 or more points for the daily living component, that for them, they don't need to meet the new 4-point rule if they have reached a total of 12, and they can still get PIP. Even though that would make entitlement more complicated to understand, it would reduce the number of claimants losing their award. Another suggestion is to allow 6 months transitional payments to claimants who lose their daily living component award. And the third possible compromise is to trade off the suggested cuts on disability benefits with getting rid of the 2-child limit of universal credit. In terms of opposition in the charity sector and the general public, critical reports have been published by Citizens Advice, Joseph Rowntree Trust, the Resolution Foundation, Health Equity North, Martin Lewis Charity, the Money and Mental Health Policy Institute, and the Trussell Trust. I won't go into details of their reports because they are very depressing, but their findings can't easily be ignored by the Parliament. A number of protests are happening around the country, and 2 large protests happened earlier this month, one in Cardiff and one in London, where over 20,000 people attended. There are several campaigns and petitions and by you I mean anyone listening, can sign. Amnesty International have started a petition to stop the cuts, and so have Carers UK and Scope. Carers Manchester has sent out information about petitions and other ways to get involved in our fortnightly email newsletter sent out to carers. So my suggestion to deal with the suggested cuts are sign the petitions, join campaigns or demonstrations against the cuts, and contact your local MP or councillor. Or second, if needed, get in touch with us to check whether you or the person you care for may be affected by the cuts, particularly by the introduction of the 4-point rule of the daily living component of PIP.
Great. Thank you, Michael. That was really useful and interesting. We'll now move on to the Q&A. So over to you, Eve. Thank you.
Hi, so thanks Lisa and Michael for that. My first question from everyone is from Michael, which is, how long does it take to get a referral and help from your service? Oh, sorry, you're muted, Michael.
I would say on average 1 week. Sometimes it can be 1 day. Sometimes I contact carers straight away the next day. I get a referral. Sometimes it can be more than a week, but on average 1 week.
Great, thank you. Our next question is, national statistics show that carers are often in financial hardship, as we've discussed. With potential benefit cuts looming, what other financial support can carers access and where can they find information on resources or grants available?
Grants are not something I go into very much, but there are 2 websites I give to people, and that is turntous.org.uk and disabilitygrants.org. If it's something outside of the benefit system, that would be 2 options, yes.
Great, thank you. We'll make a note of those websites and send them out to people afterwards. Another question is, do you help with completing PIP and WCA forms, or is it just advice around these? And can you also help with mandatory considerations and appeals?
Yes. So PIP, so all of those forms there are different kinds. So an initial application form, a review form, appeals, mandatory reconsideration, everything in that area we do. The only thing we haven't done yet is actually representing someone at a tribunal hearing. So that wasn't needed so far, and it's quite likely we would say no because of resources, but it could also be we say yes. But that we do everything.
Great, thank you. This is another question from the Q&A. Is there anything more that can be done to support carers who are caring for a relative in their home and working full-time in terms of educating their employer? There's the carer's passport, but it doesn't seem to have any impact. How can we educate employers on how they can support employees who are unpaid carers? For example, flexibility with taking the person they care for to appointments. Is there a guide for employers anywhere on this?
That's outside of my. I know that we have resources on that. So if the contact point support workers would be able to email you legal rights about you have as a carer for employment now. It's not part of my benefits advisory.
Michael, I'll come in there if that's okay.
Yeah.
But that's really helpful as well. It's a really important point. At Gaddum, we have carers policy, and we also make sure that we influence employers around how to support carers as well, and on the benefits of supporting carers. So there is more information that we can do, but a lot of it's less kind of sending an email out and more about kind of more subtly working. What we would say to any carer if they're struggling with their employer, or if they're worrying about getting employment and application and how to talk about it, just to get in touch, as Michael said, through the contact point, through Salford Carer Service and other organisations, or just directly to Gaddum, and we'll point people in the right direction.
Thank you for that, Ben. Another question is the benefit service just for the carer, or can you advise about the cared for's benefits as well?
Everyone in the household, basically. Carer, cared for. So usually when I get someone, I ask for the benefit situation of everyone in the household if they want to share that. That could be 6, 7 people if they want that. Not always, they don't always want that, but it could be anyone.
Great, thank you. Another question, kind of similar to the one before about the PIP and WCA forms. Do you have information on other services that carers may be entitled to, such as council tax support, food banks, social tariffs for phones and broadband?
Yeah, so council tax support depends on savings and income. So if it's a carer with a small income or benefits income and not a large amount of savings, they are very likely entitled to council tax support. There is also a council tax discount that is non-means tested that carers some carers are entitled to. The social tariffs are also income based. So if someone gets universal credit and has a small amount of earnings or no earnings, many broadband internet providers have social tariffs. United Utilities has something for they can reduce your water bills if you are in benefits and meet some other criteria as well. Yeah.
Just to let everyone know, we'll be sending out some further information about benefits and finance in our follow-up email, so please keep your eyes out for that. And now I'll be handing back over to Emma for the quiz.
Great, lovely. Thank you very much, Michael, and thank you, Eve, for the Q&A. So, like I said, we will now take a short break from the discussions to do a quiz about carers in Manchester. Unfortunately, there's no prizes for the winners, but it is a chance for everyone to think about what you know about unpaid carers in Manchester. So I will launch it now, so it'll hopefully show on your screens in a minute, and I'll give you a couple of minutes to fill it in, and then we'll have a look at the answers together. I'll read through the questions and answers, and let's see how you all did. So the first question was, how many carers are there in Manchester based on the census from a few years ago? And on this, we've got well, the census answer is the 37,000, but about half of you have answered 57,000, which probably is closer to the real number, but based on the census, it's 37,000. We know there's at least 37,000 unpaid carers in Manchester. The second question was, what age group has most carers in Manchester? And on this, the correct answer is 16 to 49 years. So over half of unpaid carers, or 55% in Manchester, are in this age group. And obviously, this is also an age group that is typically having a busy period of life. So these carers often have to balance work and family life with being an unpaid carer. And then the third question was, in Manchester, are men or women more likely to be carers? And on this, 100%, everybody got this right. So women, it's nearly 60% of unpaid carers are women, and just over 40% are men. And then the last question was, who are people caring for most in UK? This is based on research by King's Fund a couple of years ago. And for this, the correct answer is mother or mother-in-law, which I did find surprising, as we've got about a nice split between all the answers here. And yeah, I did find that a bit surprising. So about 1 in 3 carers care for mother or mother-in-law. This is followed by husband, wife, or partner at 18%, father or father-in-law at 16%, and son or daughter at 14%. So thank you, everybody, for taking part in the quiz. So we will now move on to the final discussion of this evening, which is about mental health and well-being of carers. And as before, if you have any questions about this topic, you can post those in the Q&A or the chat. It did end up working quite nicely in the end. So for this discussion, we'll first go back to Lisa, who has been an unpaid carer for the last 20 years, and she's also part of our lived experience panel and has been involved in planning this webinar. Great. Thanks, Lisa.
Thanks, Emma. Yeah, this is just some of my experience around mental health and well-being. Being an unpaid carer can be a very stressful role, especially if you are doing the majority of the caring on your own with little or no support. In many cases of long-term caring, there ends up just being one person who bears most of the burden. This can quickly lead to feelings of isolation and mental and physical burnout. In my case, I originally thought that being a carer would be a short-term issue and that my relative would eventually get better and we would both live relatively normal lives. 20 years on and this still hasn't happened. This leaves you with a feeling of grief as you try to come to terms with the life that you thought you would have, as opposed to what is now the reality and the future. As a carer, you are not only physically looking after a person with an illness or a disability, in some cases having to carry out personal care and administer medication, but you also have to take on many other roles, such as admin skills for all the paperwork involved, telephone calls, advocacy, financial responsibilities, and for this you have to become very organised. There's no training or instruction manual on how to cope with it all, and it can become very difficult and overwhelming and have a negative impact on your physical and mental health. It has taken a toll on me physically and mentally, and I suffer from health issues such as fatigue, anxiety, depression, and insomnia. Carers also tend to neglect our own health needs in favour of the person we are looking after. When you are attending to their needs, you just don't have the time or energy to book in or attend appointments for yourself. It has also affected my work life and financial situation due to not being able to commit to set hours in a job, and not knowing when a crisis will happen and how I will have to respond. Working along caring full time is nearly impossible, especially if you're doing it alone. So this can lead to feelings of worthlessness, a lack of purpose and direction, and loss of hope for the future. Finding appropriate support can be really hard. Little things can make such a big difference. I remember having a visit from a support worker in the early years of my caring role, and it was so powerful that I remember it to this day. This lady had come to see me and not my relative, which hadn't happened before. The lady that came didn't even really speak. She just really listened to me for the first time as I offloaded how I felt and how much I was struggling. I was so grateful for that. Just being able to speak to someone and have them listen to me without interruption was so powerful, and it made such a massive difference. Something as simple as that should be made available to all carers. I also joined a carer support group, and that really helped me break down the isolation that I felt. Knowing that I wasn't on my own and listening to others sharing the same difficulties really helped me to keep going, and would even find things to laugh about. I would recommend support groups to any carers who are struggling. Other things that have helped me are learning about things like stress management, problem solving, relaxation, breathing techniques, and meditation. Some things I wish I'd known earlier in my caring role is how to pace myself better, what to just let go of, and how to pick my battles more carefully so that I could conserve my energy for what really mattered. I think I wore myself out very quickly trying to cope with every crisis. I soon learned that another crisis will soon be coming along soon enough. Things that I worried about back then don't seem so important now, and I wish I could have had someone around who could have told me this. Taking a break is very important for a carer's mental health and well-being, but it's something I haven't managed to do very well over the years. Many carers cannot leave the person they are looking after, and adequate respite services are few and far between. So many carers don't get a break, which can lead to a burnout or a crisis. I have also felt guilty just thinking about doing something that I enjoy, as I always felt that if my relative wasn't happy, then I couldn't be happy either. But I have learned that helping myself is a coping strategy, and so it is beneficial for them too. And it doesn't have to be a long break or a holiday. Just taking a small bit of time in the day for yourself can make such a big difference. It could be something just as simple as watching a TV series that you like, sitting in the garden, reading or listening to a good book, or taking a walk around the block. All these things add up and help you cope. And so I'd like to ask a question for Neil Grace, who will be speaking soon. And that is, what support does Greater Manchester Mental Health offer for carers? And is there more that you or other carer services could offer that they are not doing currently? Thank you.
Right. Thank you so much, Lisa, for sharing your experiences again. It was really insightful and interesting to listen to. So we'll now move to our final panelist, Neil Grace. Neil is the lead for service user and carer engagement at Greater Manchester Mental Health NHS Trust. Over to you, Neil. Thank you.
Thank you, Emma. And yeah, thanks as well, Lisa, for sharing your experience. It's yeah, I mean, just thinking of what you were saying there, as well, all the stuff you do as a carer, and it's the list sort of goes on and on, doesn't it? It's inexhaustive, I think. And I think for me, particularly for mental health carers, where you're caring for somebody with their mental health as opposed to a physical issue, and it's not as visible, is it, as pushing somebody around in a wheelchair and so on. So I think it's really, really important for me that mental health staff are able to, you know, a big part of my role is sort of training for our staff to make sure that staff are able to identify who these key, meaningful people are in the lives of our service users, people accessing mental health services, and able to support them in their own right and listen to them and involve them in the care of the person. I'll really, really quickly just give a really quick overview of who we are at GMMH, Greater Manchester Mental Health, for those of you that don't know. So we're one of the largest specialist mental health providers in the country. So we work across quite a big area, providing both inpatient, so when somebody needs a hospital stay when they're poorly, around the mental health, but also community-based mental health services as well. And that is across the city of Manchester, but also Bolton, Salford, Trafford, Wigan, and beyond, really. In addition to sort of mental health services, inpatient community in those areas, we also have quite an exhaustive list of specialist services as well, including some addiction services across Bury, Bolton, Salford, Trafford, forensic services. We've got one of 3 mental health and deafness units in the country, a number of prison services as well. So we're a big organisation. We have over 7,000 staff. We work from I think it's 109 different bases across GM. And we work with approximately 97,000 patients a year. So really, really big footprint. So I think my role is to support services to identify carers, involve carers in care, and support carers in their own right, as well as we've heard from Lisa and I think everyone's alluded to it in their discussions. Caring for somebody, whether it's around the physical health or the mental health, has a massive impact on the carer and their own mental health, physical health, well-being, and so on. One thing I really wanted to touch on, which some of you might not be aware of, some of you might be, is our Recovery Academy. It's a fantastic resource. So Recovery Academies came over from the States about 35 years ago. It's effectively a college, a recovery college, that you guys, anyone on the call here, can access for free. So it was founded in 2013. We've got over 2,500 students, service users, people accessing our services, but also their carers. So carers, family members of people accessing mental health services, members of the public, professionals from other organisations can access more than 60 face-to-face courses and over 200 digital resources. So it's a really good support for a lot of people. It's good for the patient. They might be on a waiting list while they're waiting to be seen for their mental health, as opposed to just having deteriorate and the impact be on the carer. They can access some really, really useful courses around, you know, to learn about a particular diagnosis, how to live well with, whether it's dementia or, you know, but carers can also access any of the courses as well. Really, really useful. Digital resources as well. We're aware that a lot of people can't access face-to-face, or because they're a carer, they might struggle to access face-to-face sessions. So we've got a lot of online sort of e-learning you can access. We have one called Caring for Someone with a Mental Health Condition or Addiction. So it's got loads of information in there about how to manage in difficult situations with the person you're looking after, your rights as a carer under the Care Act, your loved one's rights under the Mental Health Act. So there's a lot of face-to-face training that you can access. There's online learning. There's self-help resources. I know that a lot of carers will get these resources and actually share them with the person they're looking after to help them manage their own mental health better. Things like managing sort of negative thinking and this, that, and the other. We've got there's a radio station, podcasts around mental health, and so on. So that's really, really useful, and I wanted to make sure that people were aware of that. Also, on our website, so if you just Google GMMH for Greater Manchester Mental Health, you'll get to our website. It's the first one that comes up. We have some carers pages there. So a big part of my role has been over the last 9 years, since I came to post, it's been going out speaking to carers about what sort of information they find useful and developing booklets, leaflets, fact sheets. So we've got things like a mental health carers handbook. We've got guidance for carers around mental health services, what to expect, a booklet for carers around confidentiality, information sharing in mental health services, why sometimes we might not be able to share certain information, but what you can still expect. I'm working on a new booklet for carers all around the Mental Health Act and the Care Acts and so on. So that's something maybe that is useful to know. As well, I just wanted to use the opportunity to shout out about the website. I mean, there's all sorts on there. If there is anyone on the call and they're supporting somebody who is under GMMH, we've got things like PALS, PALS workers across the trust. So they are really, really useful. So patient advice and liaison services. If you feel the person you're supporting isn't getting the care and treatment they need, you can link in with PALS and they will help to liaise with that service on your behalf and support improvements in care and so on. I can see Emma's come on now, so that's my place to stop, I think.
Thanks, Neil. I can hear that there would have been a lot more to share about as well, but
Yeah.
hopefully Eve will have some interesting questions, and that gives a chance for us all to hear a little bit more about the support available. So over to you, Eve. Okay.
Thanks. So the first question we've got is, how important do you think breaks are to carers? Because a lot of carers feel guilty about taking breaks. So what would your stance on that be?
I think, yeah, absolutely. I'm a carer myself, a parent carer, and it's massive. I think caring has an impact on every single part of your life, doesn't it? Whether your relationships with your other family members, and being able to get away is just it's sort of that double-edged sword, I think, because it's tinged with guilt on one half. A lot of people don't want to take that time away because they feel, what about the person I'm looking after and the support? But then on the other side of that, carer burnout and so on is a massive thing. And, a lot of people go on to actually use our services as a patient because they've not been supported as a carer and they develop their own mental health issues. So it is really important. Yeah, absolutely. I think it's really, really important, and I think there's definitely more that could be done. I think a lot of it's, I guess, linked to funding and so on, and putting support packages in place for the poorly person. But definitely, they're massively important and much needed, I think.
Great. Related to what you just said about having something for the cared for, what can be done currently to ensure that those we care for can be somewhere safe, supporting, and stimulating? So for a few hours, perhaps, to allow regular short periods of respite for carers who need it.
Yeah, I think this is coming. I think it's been a long time coming, but some of you on the call might be aware of things like community transformation. There's been a lot of work to, I guess, update mental health services in line with the 10-year long-term plan. There are things like crisis cafes and living well services and things like that popping up all over the place. And they're only going to get better. I think you're dead right in terms of the environment in which people receive care and treatment is really, really important. It has a massive impact. some of you might be aware of things like Number 93 in Manchester that people can drop into, and there's loads of groups, and it's volunteers play a really big part in that as well. A fantastic place for people to go to, you know, if they might be struggling and looking for work, and they can attend things like gardening groups. I've been working with a number of our services to look at recruiting volunteers to help support with things like gardening groups, and we have a really dedicated volunteer workforce as an organisation as well. A lot of carers, but also patients who want to either work in mental health services or just they're at a stage where they're doing well and they want to give back. So our volunteer workforce is really, really important. And a thing we've been really passionate and keen to lead on is developing our peer support workforce. So people with lived experience who are either in a paid role or they're volunteering to make recovery visible. And they can just, even something as simple as meeting up with a patient, a service user, taking them out for a coffee or taking them for a walk in a local park. It has such a positive impact on that person, but also the carer as well. And you know, it is growing across the trust.
So much for that. But another question from the chat, which is what proportion of GMMH work is inpatient and what is outpatient?
Crikey, I don't know the exact percentage. By far and wide, massively, it's community mental health services. We see so many more. Yeah, absolutely. I think it's something, and this is me plucking it out of the air, but it's under 5% are seen in an inpatient. Having said that, it's really important that we still get inpatient mental health services right. A big piece of work that we've done recently for Manchester, which some of you will probably be aware of, is Northview. So it's a brand new mental health inpatient facility serving North Manchester, based at Crumpsall, North Manchester General Hospital. It replaced Park House, which I think was one of the only few mental health inpatient units in the country that still have things like dormitory style bedrooms. Really abysmal. It's not that sort of environment isn't useful for anyone. We actually work with a group of both service users but also carers. Over about 2.5 years, we were meeting on a monthly basis, and their lived experience, carers as well, helped to shape what Northview is now, right down to the name, what sort of layout on the ward, what sort of digital technologies they want to see on the ward to help people get well, what sort of staffing mix they feel are going to be useful based on their lived experience, rather than us as an organisation just saying, we've got some money, we're going to build this, and that's what you're getting. It's really important, as Ben alluded to before, that we're co-producing these environments for people based on their lived experience.
Great, thank you. And a final question for now. With the GMMH Recovery Academy, you spoke about the different things that were on offer, especially carers to help themselves cope and stay resilient. Where are these courses available? Are they in different locations? Are they online? And how available are they, do you think, to carers across Manchester?
Really good question. Thank you. And I think I'll also just add on a little bit in terms of Lisa's question about other support available as well. So in terms of the Recovery Academy, yeah, absolutely. Online resources are available for people who do struggle. We appreciate a lot of people can't get out and about, and you know, it might be due to the caring role and so on. So we've got a lot of the courses do take place online, face to face. Some are based at Prestwich, our headquarters, but yeah, we do try and get them out and about across the trust. So we use community venues. We've got one in Stretford that we use quite frequently for some courses. We've got one Timperley, Redbank. As well, Wigan, Bolton. We try and sort of get them out across, as where we can really. And just, some of the courses, I think there are some courses that you can access for yourself, in terms of things like yoga and well-being, an introduction to mindfulness, all that sort of thing. But there's also courses you can access to better understand maybe the mental health condition of the person you're supporting. I think that has a really positive impact on a lot of carers. As well. In terms of Lisa's comments on other support available, I think we could always do more. I just wanted to shout out a few things based on what carers have been telling me recently. Lasting powers of attorney, advice on wills, trusts, that sort of thing. We've actually got a talk coming up, so we have them quite frequently with a qualified solicitor, and he comes and speaks to. And this came about from me having a chat with a carer who basically said, look, I'm getting to a certain age. I'm not going to be around forever. I'm really concerned that when I pass away, my child, who has both drug and alcohol issues, but also mental health issues, is going to inherit my family home, a large amount of money, and I can't see it going very well. So I linked her in at the time with, you know, a solicitor, and we looked at wills and trust fund to keep Son safe once she had passed away. So we have regular sessions with the solicitor. We've got one coming up. I think it's the last Monday in June at Press Switch. People can get in touch with me and we can book you a place if you want to. But also as well, another thing in terms of support, I would just want to shout out our 24/7 helpline. So until a few years ago, it was an out of hours crisis line for patients, for poorly service users when the community teams were closed. We saw a bit of a gap in this, you know, COVID in particular hit, and it was opened up as a 24/7 helpline, not only for service user, but for carers. I took a lot of calls on that myself during the pandemic when I was redeployed. I spoke to so many carers who wanted to speak to somebody about their own mental health. So you can speak to a qualified mental health professional or ask for some advice specific to the person you're supporting. So basically, you call NHS 6111 on your phone and you select the mental health option. I think it's option 2. And you'll be put through to us locally in Manchester to speak to somebody.
Great. Thank you so much for answering our questions. And thanks everyone for all of your questions throughout the webinar today. I'm going to hand back over to Emma now to close out today's session. Thank you.
Great. Thank you, Neil and Lisa, and thank you, Eve, for running the Q&A session. So we are, like Eve said, we are now getting to the end of the webinar. The time has flown by. I hope you've all found the webinar thought-provoking and useful. I don't think the hour and a half was enough. We could have had a bit more discussions to continue on this. Before we finish, I can see you've come on camera, Ben. Would you like to say a couple of words as well?
Oh, I was just coming on just to wave goodbye. No, I'll leave it to you, Emma. But I suppose just to say again, thanks so much everyone for being here, for all the questions in the chat.
Okay, thank you.
Yeah,
no problem. So yeah, before we finish, I wanted to say thank you to the panelists, Abid, Ben, Lisa, Michael, and Neil for their contributions. Thank you to Ina for moderating the chat and Eve for moderating the Q&A. A big thank you to all the lived experience reps who were here today and involved in planning the event. And thank you to everyone in the audience for making the webinar such a success. And otherwise, thank you everyone for your time. I hope you have a lovely rest of the evening and enjoy Carers Week.